You might have noticed that waves of COVID-19 seem to have stopped, but the reality is hospitalizations in Canada are about 6 times higher now than they were at the lowest point of the pandemic. More than 3,200 people were hospitalized in Canada the week of April 11th. That's according to the most recent data available from Health Canada. Now, a new variant of concern is spreading rapidly in India. So joining us with more this morning is infectious disease expert Dr. Abdu Sharkawi. I should also say you're obviously an avid Leafs fan. Congratulations on the win.
Thank you. Good morning. Nice to talk with you, Anne-Marie.
What do we know about this new subvariant that is spreading in India right now?
Well, it's an interesting variant because what it is essentially a hybrid of 2 of the previous Omicron subvariants. And specifically, there's a new mutation in the spike protein that makes it potentially much more contagious and transmissible than earlier variants of Omicron. And that's been translated into a much higher surge of infections. In India in particular, it's led to a surge in hospitalizations. And not surprisingly, when we see a variant like this spreading in a big population like India, it's detected in many other countries. Right now, we know at least 29 countries are involved. We don't have any confirmed cases in Canada, but I think it's only a matter of time before it is here. On the more positive side, while it is increasing the number of hospitalizations, it does not seem to cause disease that is more severe. So we're not seeing the same level of intensity that would cause ICU admissions or directly causing deaths. But we still very much need to keep our eye on this and make sure we don't dismiss it.
Throughout the pandemic, we got used to seeing waves of COVID-19, the second wave, third wave. What is the situation like in hospitals here right now?
Fortunately, the situation is relatively stable, which means to say that we're not seeing huge surges of patients being admitted specifically for COVID-19, and we're certainly seeing a very, very rare situation of people admitted needing ICU. Now, that being said, the rates of circulating virus that are in the community are quite high. It's just that they're not surging anymore. And that means that this virus is pretty much here, likely here to stay. And while we've probably passed the pandemic phase of COVID-19, we're now pretty clearly in the endemic and probably what we call hyper-endemic phase, which means that it's around. It's not necessarily spreading very rapidly, but it's in very high numbers. So we need to make sure that we don't take it lightly. It can still cause sufficient disease to make people sick enough that it's going to diminish their quality of life. And in those who are elderly or very young or have immune compromising conditions, it can still be quite a threat. So we want to make sure that we're still smart about updating our vaccine status and using safe ventilation spaces wherever possible and just avoiding infection, because even a small percentage of people means a lot of people across the population, and that could end up meaning pressure on our healthcare system. We saw that exactly with Omicron.
That's where I want to end our conversation today. What kind of pressure is it putting on our already strained, some people say broken healthcare system, with an increased number? Even if it is a small percentage of people, it's still more people.
Yeah, it's something that we can ill afford to have happen again. If people are admitted to hospital with COVID-19 on top of another diagnosis, it often makes their admission much worse. It increases their length of stay and potentially leads to other complications. So that immediately translates into greater pressure within our emergency rooms, our medical wards. And we saw that with Omicron. We certainly want to avoid that. And importantly, long COVID is pretty much a reality now. Mm-hmm. The persistence of this virus in different organ systems is very clearly established. And so we want to do everything that we can so that even patients aren't needing directly hospitalization, they don't end up becoming quite sick so that they can't work or maintain their quality of life and end up being debilitated. And that's a problem that still very much exists, and we shouldn't dismiss it as a possibility going forward in the future.
Dr. Sharkawi, great to speak to you again. Congratulations again on the Leafs win.
Thank you. And Eid Mubarak to everybody celebrating the end of Ramadan today.
Yes, of course. Thanks so much, Dr. Sharkawi.
Thank you.
Hey, Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.